Breakthrough technology, a discovery that will improve forever the safety from stroke. Did you know that you can beat the velocity of stroke in real time? And that a home health solution can eliminate stroke risk from the onset? Hi, my name is bahigaelhaggar. I am a veteran of health, licensed therapist, a partner of family medicine, faculty published author. I'm not a physician. I started as a UN field worker. For the past 2 decades, I head the National Health Register with its notable achievement, natural alternative for cancer therapy from here to eternity. I lost my son to stroke. Despite all efforts, nothing was fast enough to save his life. I firmly believe that evidence-based early intervention supports the body's natural function to avoid risk. It is historically proven technique. Harvard School of Medicine, Dr. Natalia Sanos-Rost, professor and neurosurgeon, announced stroke is preventable, treatable, and beatable. Doctors of WHO, the World Health Organization, apply emergency care model that saves 40 million victims of underserved communities worldwide. It helps home health users. In this video, we'll introduce you to hidden secrets and unique tools, included in-depth information like stroke facts, the types, the root cause and signs, and also to the vital knowledge that significantly improves the mechanism for safety to avoid incidences and repeats. Information is only for education. It does not suggest medical change. Contact your provider for your health need. If you are at risk of stroke, a survivor or caregiver, follow this video to the end for stroke safety method. Before we go any further, press the like button and subscribe to the channel for the latest on prevention of stroke. We will be back. Cerebrovascular stroke is caused by a blood clot that blocks the supply to the brain. It attacks the healthy indiscriminately. Stroke damages the nervous system, the seventh nerve, facial nerve, and the vagus nerve, also known as cranial X10. CDC states that stroke is the first cause of death in USA. 795,000 have stroke annually. Half die before transporting. 12 million died from stroke. 148 million American is on treatment of the underlying cause of stroke, hypertension. 39,000 underage children die from stroke. Stroke survivors endure 70% disability, and it can be avoided. I added the links in the comment section for you to look at. Stay with us. Press the like button and subscribe to the channel for more on stroke safety. The prevalence of stroke is led by some factors. First, there is a mix-up. Although instructions on how to treat and prevent stroke has been in place by leading health authorities, it neither ratify risk nor apply the necessary technology to help the patients. The second reason is common misconception. Stroke is old people disease. Stroke cannot be prevented, or wait until your face droop, call an ambulance. Stroke is caused by food. Fat particularly is mentioned, but stroke is a blood clot, not a fat clot. Most of the people have stroke because of a blood clot. 90% of the blood clot is damaging to the entire system. Now, the hidden secrets is another cause. Warning signs of stroke, they are not signs of the beginning of the stroke. And that the prior condition of warning sign is the stroke onset, which definition is not mentioned, and the signs are not explained. Now there is a shocker. Fever, led by blood clot, not any fever. By blood clot is the determining risk factor of stroke. Diagnosis is known as hypovolemia. This is when the body loses control over temperature and volume. It shuts the auto-cooling system, dehydrates the system severely, and the intake is prevented and no sweat. Scientific evidence shows that controlling hypovolemia can actually preclude the progression of stroke if it's applied in the 3-minute response window of time from the completed symptoms. We'll explain that later. The medical report of death from stroke is thermoregulatory failure. Leading scientists declared that fever worsens stroke. Now, from what you have heard, what are the two major causes of stroke? Can you take a quiz? Write down in the comment section what your answer is. Stay with us. Press the like button and subscribe to the channel for more on stroke safety. We'll see you after this. Types of stroke. We have 3 types of stroke. Ischemic, which is the transient stroke. TIA, hemorrhagic, which is the bleeding stroke, and heat stroke. The causes are 2 categories. Physical causes from drug or accidents, and both sometimes. Behavioral causes from anger and shock. I have a little note on the anger. 70% of behavioral stroke is caused by letting the anger out. Hypothetically, it helps to calm down. However, it severely overworks the system, and it can be the risk. You be healthy more if you stay with aerobic breathing or box breathing, where you can inhale 4, keep it for 3, and then exhale on 4. That will take down the anger, at the same time include oxygen. Now, the symptoms of strokes, some of them are shared and some are various. High blood pressure, high fever, dehydration, and pain are shared. However, TIA, for instance, in addition, has some sweat, short coma, 1 or 2 days at a time, and also it mimics cold. They have sore throat, and TIA does repeat. Hemorrhagic stroke is top trauma, it's unconsciousness or excruciating pain, and it has to be immediately handled. Heat stroke, high blood pressure, high fever, 103 or more, and no sweat, total dehydration. It also shows visible pulse. Some suggest ways to save a victim from dehydration by sedatives or medicine. These actually activate in 25 minutes, and we only have 3 minutes to save a patient. Some suggested immersing in ice, and that 78% die from being treated by that method. If somebody now have a heart attack or a stroke, or is confused about the symptoms, what do you think they should do? The first thing they do is to specify the symptoms, the signs. Are they signs of heart or brain attack? In this case, you will use symptom checker. Cerebrovascular stroke have high blood pressure, high fever, no sweat, and heart attack have high blood pressure, chest pain, and heavy sweat. That will be an indication of the difference. Now, the second thing you can do is to self-screen. You know how to self-screen. 1 is to take your vitals, and 2 is to check on the symptom checker. And the symptom checker in this will be the zone, the risk zone, versus your actual figures. If your blood pressure is normal as 120/80, blood pressure on the risk side is 180/100 plus. Fever is 98.6 on the normal size, and fever on stroke is 103 and rising. It does not stop rising until it is interrupted. The dehydration will be -39 on the normal. If it is under 39 on the risk side, then it is an alarm. Now, the last thing is the visible pulse. Pulse is from 60 to 100 is normal. If it is 101, it's on the risk side. Now, you have seen the risk and the normal. Compare your rates that you read from the vital signs to find out if you have a stroke. Then be on the alert. The assessment of stroke is thermoregulatory risk, hypovolemia, no intake allowed, dehydration. Now at that point, the only way you can save from stroke is the natural way to help the body reactivate its sweating function. Reactivate that by the maneuver is known as thermogulate. Thermogulate is the maneuver used with the home health solution in order to return your numbers to the normal side. If you successfully do that, it has to be in the 3-minute window of time. That is after completing the serious or the risk numbers. At this point, you will see the results. Blood pressure will slow down, visible pulse will be normalized, and the sweat restarts. If you have reached that point and you need more information on all the details of living healthy away from stroke risk, look at the comments, contact us, and ask questions and follow the guidance to stay safe. Thank you for watching.